If you're a rural healthcare provider in Georgia, there is real money coming for mobile health units. And the providers that prepare now will be first in line when the applications open. The assumption in rural healthcare has always been that expansion means building something. A new clinic, a new wing, more square footage in some way. And most of the time, the funding to do that never comes. Georgia has been awarded $219 million from the Rural Health Transformation Program for 2026. And mobile health is one of the specific named strategies that the state is betting on. The state has $17 million earmarked for mobile clinics and telehealth pods, with a plan to put 26 mobile health units on the road by 2031. Grant applications are opening soon, and the organizations that understand the program now will be right ready to apply when the application opens. At AVAN Mobility, we build mobile medical units for primary care, behavioral health, and telehealth delivery for communities who need it most. We've gone deep into Georgia's application, so you don't have to. In this video, we'll cover what the funding actually is, which providers qualify, what types of vehicles the state is prioritizing, and how to position your organization before grants open. Now let's get into it. Let's start with the problem, because the numbers are worth understanding. 53 of Georgia's rural counties have no hospital. 82 have no OBGYN. In a lot of these communities, the nearest primary care provider is over an hour away. And that's assuming that people have a car, can take the time off work, and don't have any other barrier that they need to overcome. Georgia's answer is not to build more clinics and hope providers show up. It's to bring care to where people actually live. Mobile health units do exactly that. A fully equipped clinical space on the road, in the community, without asking patients to travel. It's not a new idea, but what is new is that Georgia now has federal funding to back it in scale. So what is this funding? Georgia has been awarded $219 million from the Rural Health Transformation Program for 2026. If you haven't heard of the Rural Health Transformation Program, we've got a video on that I'll link below. In Georgia's official application under the Connecting to Care initiative, mobile clinics are specifically named as a funded strategy. Over $17 million goes to mobile health units and telehealth pods. The plan is to have 26 vehicles deployed across Georgia by 2031, with the first ones hitting the road in 2027. These aren't being funded as a one-time gesture. Georgia's application says that these units should bill for services, connect to follow-up care, and integrate into clinical rotations. They're meant to be a permanent part of rural healthcare delivery. The service lines that the state wants covered are primary care, specialty care, dental, behavioral health, preventative screenings, and substance use treatment. So what kind of vehicles can be used for this? Georgia has been clear that vehicles should match the service line that they are delivering. For primary care and general outreach, our mobile clinic and mobile outreach unit are fully equipped for these purposes. They can be customized with exam space, vaccination fridges, privacy curtains, whatever your program needs. For behavioral health, our counseling van is built to feel more like a living room rather than a clinical space. It's got soft seating, dimmable lights, soundproofing, and this matters because for someone in crisis, the environment is part of the care. And any AVAN vehicle can be equipped with satellite Wi-Fi, making telehealth possible anywhere in rural Georgia. So how do you get in front of the funding? Grant applications open soon, with the first vehicles targeting to hit the road in 2027. Right now, Georgia is distributing letters of intent to rural hospitals and beginning program assessments. This is the preparation window, and it matters. Organizations that understand the program now will write stronger applications. Know which service lines you're building around. Know how your program connects to what Georgia's trying to accomplish. Better access, fewer non-emergent ER visits, and more preventative care in the community. And know what vehicles fit your mission before the grant window opens. That is where we can help. At AVAN, we've worked with health departments, FQHCs, free and charitable clinics, tribal organizations, and a lot more healthcare and outreach organizations across the United States of America. Reach out before grants open so that when they do open, you are ready. Now is the time to transform the way rural healthcare is provided in Georgia. With the 17 million committed to mobile clinics and telehealth pods, and 26 vehicles expected on the road by 2031, this is a massive opportunity for rural health providers. Keep your eye on the Department of Community Health website. They'll be posting the applications once they open. And if you want to find out what type of vehicle will fit your program before the applications open, reach out to us here at AVAN. We're always here to help.